Since the pandemic, we have seen a rise in the number of patients coming with mental health concerns to the emergency department. Often mental health patients come to the emergency department due to a crisis. So when we are able to have proper space, it does make a big difference. But having a dedicated mental health zone would certainly be a game changer.
My name is Dr. Lindsay Woods. I am an emergency physician at Richmond Hospital. I've been here for 9 years. We see people who are in pain, we see people who are anxious, scared. Often it's the worst day of their lives. But I think most of us who go into it, we go into it because we're passionate about helping these populations. The emergency department environment it's chaotic. It's busy, it's loud, it's bright. There's monitors beeping. There's critically ill patients who are in hallways. It's not a very calming environment.
So the environment in the emergency department is as one would imagine. Things are running 24 hours a day. Richmond Hospital is no different than others, which makes it challenging to find space to see patients. And now the waiting room is often overcrowded, sometimes standing room only, which makes it hard for patients that are feeling anxious. They've built up the courage to come to a hospital, and sometimes they have to wait in the waiting room for a long period of time. Unfortunately, some patients will determine that maybe this isn't the right environment, it's making them feel worse, feeling more anxious and scared, and they may leave before assessment and treatment. Sometimes the environment itself has kind of escalated their anxiety, their fear.
I always tell patients when they come in, thank you for coming in because we want to help you. And we truly do. That's what we want. We don't want to be escalating patients or in those scenarios. We truly want to get them the help that they need and they deserve.
But having a dedicated mental health zone that's protected, that's quiet, that's an environment that is calming, I think will serve our patients very well. It'll be better for healing, would definitely allow patients to have privacy, to be able to talk, share their concerns without having other people listen or patients on the other side of a curtain hearing what they're saying.
The idea that we could actually have this dedicated space, I think makes everyone feel safer. It makes the patient experience more enjoyable. And I think that there's a lot of excitement around it and positive feelings.
We struggle to really provide the best space for patients right now. We know that if we do have a mental health zone, even if it's built in a year and we have 5 years of use, that will serve thousands of patients. It will enhance care. It'll improve the working environment for staff. It will improve the healing process. And that would serve us well until the new tower is built and we are able to move into a larger dedicated mental health zone. I really like the variety of medicine and the kind of the interaction with all the other specialties within the hospital. For me, what keeps me going is knowing that myself and our team, that we make a difference to the population. We have a great group of physicians and nurses that support each other.
It's not always that I've had a good shift because I've had good outcomes. Sometimes it's having difficult conversations and delivering bad news. But if I feel like I've done that in a way that's helped the patient or their family, that's a good day. The work that I do is important and I love it. It's very satisfying to see patients who have been treated, who have improved, who we feel is safe to go home, and their families want to have them home. They see a difference in their family members after being treated. I think about every patient as if it were my family member and how I would want them to be treated. It's hard right now to think of something that would help more than this, something that is more important than this right now.